practicing 调笑. Okay, let me run through with you a brief introduction of Dr. Kieren Bong. Dr. Kieren Bong is a cosmetic doctor currently practicing in the United Kingdom. He is a cosmetic doctor trained in both medicine and surgery. Currently, he is the clinical director of the very successful Essence Medical Cosmetic Clinic in Scotland and clinical lecturer in cosmetic dermatology in Buskerud and Westfold University in Norway.
And usually my masterclasses are slightly different, is that I don't want to just tell you this is what you do. 0.2 here down to the bone, laterally, then 0.2 down to the bone, and laterally 0.1 down to the bone. That is usually how medicine is taught. You see one, you do one, and subsequently you teach one. But very few of us actually understand the thought processes behind why you choose those entry points. Very few of us actually stop and think about why is it I'm doing that, which is why it's very difficult for clinicians to progress. The 3D ultimately was constructed about 5 years ago out of the desire to have a procedure that encompasses the entire face. Okay? Now we've seen lots of cases when patients come in to see you with jowliness and clinicians focus too much on filling because they think by filling up the cheeks they are going to be able to obliterate the jowl. Yes, but the patient will look like a chipmunk. Alright? So we don't want to fill the face, we want to sculpt and contour. For an advanced technique like the 3D Ultimate Medical 2.9 lift, I have to make a few assumptions. I.e., you're reasonably skilled in using cannulas and you're familiar with the I was going to talk about fat compartment number 5 first. When we age, there is extension of the lid cheek junction. That's because in the superficial fat compartment, that compartment number 5 loses significant amount of volume, which is why we have accentuations of the hollowness and then extension of the lid cheek junction. So I want you to keep that in mind. Then I want you to start to think about why it's so important for us to know about fat compartment. Ever think about down duvet or feather duvet, which you don't use in this part of the world. But feather duvet, if you take the duvet sheet out, inside you've got multiple pockets. And each pocket contains the feather and the down. Now the reason why there is a pocket there is it stops the feather from moving around within the duvet, and then you suddenly have a big spot that doesn't have any feather to keep you warm. So it's to stop the feather from going from one compartment to the other. Your fat compartments are exactly the same. It's demarcated by septae. Okay? You have septum. Now, why is it important? It's a superficial fat compartment, and you have the SMARS sitting on the surface of the muscle. The concept to remember is the superficial fat compartment sits on a slippery slope. SMARS is a dense fibrous mesh, and it's slippery. What happens is that, in the next slide, I'm going to show you the superficial fat compartment is sitting on something that's slippery, but it's attaching itself to the surface of the skin, and due to aging process, it glides downward, but it hooks the skin with it, and it drags down. Okay? I want you to keep that in mind. This is what happens as a result of the retinacular cutis. Everything drops downward and inward. Now, this is a technique. I'll go into it step by step. I want you to understand the thought processes